Are you going?
Yep.
All right. So for palpating, we're going to palpate some of the muscles or some of the bones that are of significance for Jihei's injury. We're going to start with the manubrium, which sits right about here. And the significance of this is the only point for the upper extremities to connect to the axial skeleton of the body. This is also where your clavicle connects to the rest of your sternum there. Your acromion process, which is right there. Significance of that, your AC joint is there, and that's where your shoulder and your scap come together to connect. Your coracoid process, internally and externally rotate your arm. It's gonna be about right there, and then turn around for me. You have your lateral border of your scap here, and you have, yeah, that helps a lot. Then you have your medial border, and then you're gonna have your inferior angle, and then from him, you can see the spine of his scap is right here. And the significance of the spine of the scap, it splits where your infraspinatus is down here, and your supraspinatus up here. And going through what we had, part of the infraspinatus, or the supraspinatus was strained from overuse. And then, yeah, you're good.
We're gonna do movements of the shoulder girdle now. Elevation is important with, what's her face, Jin, because when she holds her violin on her left side, she's elevating her shoulder girdle. And then depression, obviously to like get it out of that movement, but also to lift and unlift her right arm. She does protraction, which is here. And that is important to get her shoulder in front of her body so she can play the strings. Retraction is here, and then she does retraction as well to move her right arm backwards, and then upward rotation and downward rotation, and this is important because when obviously she's playing with her right arm, she's doing both of those movements. So for the first part of our therapeutic plan, we are going to use this massage gun as a soft tissue release. First off, we're gonna start with the pec minor because her pec minor is going to be very tight from overcompensation. So you get the coracoid process and you palpate right there, and you come at the superior part of the pec and you go here, slowly and surely, and we can also go into external and internal rotation of the shoulder, and you can feel that through the full range of motion. Boom. Next, we're gonna flip over onto the face down. We're gonna get his posterior deltoid muscles over here. We're gonna have him bring his arm over here. We're gonna have him go through this range of motion here, get all up in this John, and then we're gonna go up front and get all up in that John. We're gonna get his scaps as well, levator scap for that elevation rehab, and yeah.
Our therapeutic plan is stretching. We're gonna start with some band work. We're just gonna do around the world. You're gonna wanna keep your arms as straight as possible. Just kind of follow whatever motion you want. It feels really good. This is gonna help with range of motion and pain. So just kind of do that for a while. Okay, next we're gonna do thread the needle. So the most effective way of doing this, you're gonna wanna get on the floor and just thread the needle and just kind of bend. That looks so good too. And just kind of bend with that. Oh, that feels awesome. Okay. That's also gonna help with range of motion, and that one's really gonna help alleviate pain. It loosens you up a lot. And then you're gonna find something to hold on to
Shoulder width height.
and just
It
kind
could
of,
be a wall.
oh, that feels good. Just kind of rotate externally, and you'll feel that right up in that shoulder, right up in that John,
Right.
is where you'll feel that. Just kind of hold that for 30 seconds and do that as many times as you want.
All right, I'm back with the shirt on. So now we're gonna do some strengthening exercises. We're gonna do some of these, which is horizontal AB and adduction, and that's gonna strengthen just basically like your scapula back there. What's the thing? It's not my elbows. Okay, and then you're also gonna do some lateral raises. This helps strengthen the scapula as well as supraspinatus and levator scapula. When up there, you want to do light weights. You don't want to do super heavy to avoid risk of injury. And then you're also going to do this. What are you saying? What's that?
Nothing.
We're cutting that out. We're going to do this. Internal and external rotation. So what this does is it helps that rotator cuff, and it's gonna just, light weights, just not too heavy, it's gonna strengthen that. And yeah, those are some strengthening exercises. You can also use the band. Do some band work. You wanna keep your elbows in extension, making sure that you're focusing mainly on this gap. You can kind of see as the bands go out with resistance, the scapula will rotate, and that's also good for helping for injuries.